This research delves into the public's perception of COVID-19-related safety measures for long-distance travel and its impact on their choice between car, train, and aircraft. Employing a hierarchical information integration approach and a latent class choice model, the study captures subjective perceptions and models the data. The findings reveal 4 distinct segments based on safety perception and mode choice, underscoring the importance of understanding individual perceptions in travel behavior. This research could provide valuable insights into how different segments of travelers perceive risk and how this influences their travel decisions, particularly in the context of COVID-19 safety measures. The research paper discusses various attributes considered in long-distance travel mode choice models, including travel time, cost, and frequency. It highlights inconsistencies in the valuation of these attributes across different studies due to contextual factors like geographical location and travel purpose. The Hierarchical Information Integration (HII) approach is explored to capture a broader array of attributes and their trade-offs. This involves evaluating groups of attributes individually and then combining them in a bridging experiment. The HII approach has been proposed by several researchers, including Molin and Timmermans, 2009, Boss et al., 2004, and Apoval et al., 1994. The paper also discusses the application of HII in 2 notable examples, one focusing on airline safety perception following the crash of Malaysia airline flight MH17, and another on comfort perception in night trains. Both studies utilized the HII variant approach and modeled the bridging experiment using a panel mixed logit model to account for respondent heterogeneity and panel effects. The section also touches upon the challenges of applying latent class choice models, LCCMs, to HII data, which can be difficult due to differences in subjective ratings between classes. Despite this, no attempts have been made to segment latent classes in HII variant experiments. Finally, the paper addresses the impact of the COVID-19 pandemic on travel behavior, particularly the drastic reduction in public transport usage during the first lockdown. The pandemic has introduced new decision factors for travelers, such as safety and infection risk, significantly altering travel behavior. The COVID-19 pandemic has significantly impacted long-distance travel, yet the subjective perception of measures implemented to combat the virus remains understudied. This research aims to address this knowledge gap by evaluating the perception of COVID-19 measures through a survey and bridging experiment. The study focuses on attributes such as infection risk, travel cost, time, and comfort level, using a hybrid incentive inducement variant survey that includes 8 attributes related to infection risk. The survey results are then carried into a bridging experiment, where respondents choose their preferred travel mode for trips of approximately 500 kilometers and 1,000 kilometers. The analysis employs weighted least squares regression models to uncover different perceptions of infection risk experienced by distinct population segments, identified through a latent class cluster model. This approach provides more information on how the perception of infection risk differs among individuals, allowing for segment-specific insights. The survey design and experimental methodology are outlined in Section 2.1, with model estimation information and data collection procedures described in Sections 2.2 and 2.3, respectively. The context of the COVID-19 situation during data collection is presented in Section 2.4. The results of the final model are presented in Section 3, highlighting implications, applications, and trade-off behavior related to long-distance travel during the pandemic. This research paper presents a novel methodology for understanding the perception of COVID-19 infection risk and its impact on mode choice in long-distance travel. The study employs an HII experiment, comprising 2 separate experiments, a rating experiment to capture respondents' perception of infection risk, and a bridging experiment that contextualizes this risk within a full mode choice experiment. The rating experiment focuses on attributes such as onboard crowding, which is a key influencing factor in risk perception, along with other trip-specific, policy-based, and pandemic context attributes. These factors are crucial in understanding how individuals perceive the risk of infection when choosing between different modes of transport for long-distance travel. The paper's approach is novel in its application to long-distance travel, where train and aircraft are the primary passenger transport alternatives. By examining the perception of COVID-19 infection risk and its influence on mode choice, the study aims to provide insights into the decision-making processes of travelers during the pandemic. The findings of this research have significant implications for policymakers and transport operators, as they highlight the importance of addressing perceived risk factors in order to maintain public trust and confidence in the safety of long-distance travel. This could involve implementing measures to reduce onboard crowding, enhancing cleaning and disinfection protocols, and providing clear information about COVID-19 safety measures to passengers. In conclusion, this paper contributes to our understanding of the complex interplay between perceived infection risk and mode choice in long-distance travel during the COVID-19 pandemic. Its innovative methodology and findings offer valuable insights for researchers, policymakers, and transport operators seeking to mitigate the impact of the pandemic on travel behavior. The authors examined policy-based attributes influencing travelers' perceived infection risk during the COVID-19 pandemic. They identify 4 key attributes: face mask policy, cleaning policy, air circulation, and government travel advice and entry requirements. The face mask policy is crucial due to its widespread adoption, while the efficacy of cleaning policy is contested but still impacts risk perception. Air circulation is tested, particularly the use of HEPA filters, and government travel advice is considered for international travel. The pandemic situation, including infection rate and vaccination rate, is also a significant consideration. An orthogonal fractional factorial design is used to construct the experiment, involving 20 rows and applying blocking to ask individuals to evaluate 5 choice sets on a Likert scale. The design utilizes Nejc software, and the full design is presented in the appendix. The experiment includes categories such as trip-specific risk factors like onboard crowding and policy-based factors like face mask policy, air circulation, and cleaning policy, with various attribute levels for each. The study examines how perceived infection risk influences travel mode choice for long-distance travel, focusing on car, train, and aircraft modes. It employs a bridging experiment combining rating and objective attributes. Respondents are presented with 2 distance categories: 500 kilometers and 1,000 kilometers, with example destinations from Amsterdam. Attributes include travel time, cost, travel class, and perceived infection risk. Travel time encompasses door-to-door time, including main leg travel time, terminal dwell time, and access, egress time. Cost, travel class, and perceived infection risk are also key factors. The study aims to capture a broader scope of potential long-distance trips by considering various factors affecting travel mode choice, particularly in pandemic contexts. The bridging experiment's design focuses on optimizing the use of choice sets, leveraging a Bayesian-deficient design generated by Nejc. This approach maximizes the number of choice tasks while avoiding dominant alternatives, ensuring an efficient data collection process. Priors for travel time, cost, and risk perception are established based on previous studies, with standard errors reflecting the level of certainty in these estimates. The design is optimized for both 500 km and 1,000 km trips, considering factors such as travel time, cost, comfort level, and perceived risk of infection. This comprehensive approach allows for a nuanced understanding of respondents' preferences and trade-offs when making long-distance travel decisions during the Omicron variant pandemic. In addition to the choice experiment, the study also includes socio-demographic questions aimed at understanding respondents' long-distance travel characteristics and their perception towards the Omicron variant. These insights will provide valuable context for interpreting the results of the choice experiment. Model estimation involves separate linear regression for rating experiments and discrete choice models for bridging experiments. These models account for respondent heterogeneity, recognizing that individual differences in preferences and risk perception can significantly influence travel decisions. By employing these advanced statistical techniques, the study aims to provide a detailed understanding of how various factors influence long-distance travel behavior during the pandemic, ultimately informing strategies to mitigate the spread of the Omicron variant. In discrete choice experiments, accounting for respondent heterogeneity is crucial. The bridging experiment addresses this challenge by employing a Latent Class Choice Model, or LCCM, to estimate multiple distinct multinomial logit models. Each model represents a unique class or segment of the population, providing straightforward interpretations of the data. This approach can be further enhanced by incorporating socio-demographic information. The LCCM estimation process involves calculating choice probabilities and class allocation probabilities. Equation 1 represents the choice probability, which is a function of the observed choice, individual-specific variables, and class-specific parameters. Equation 2, on the other hand, estimates the class allocation probability, which is essential for assigning respondents to their respective classes. The class allocation probabilities are then used to estimate a weighted least squares regression for the rating experiment. This approach enables the incorporation of additional data and provides a more comprehensive understanding of respondent preferences. By capturing respondent heterogeneity, the LCCM-BASED bridging experiment offers a nuanced understanding of individual preferences and behavior. The estimation of multiple MNL models and the incorporation of socio-demographic information provide a rich framework for analyzing complex choice data. The results of this experiment can inform policy decisions and marketing strategies, making it a valuable tool in various fields. The rating experiment analysis in HII employs a multiple linear regression approach to understand the impact of each attribute on the scoring of risk. This involves estimating S number of regression models, one for each segment obtained from the Latent Class Cluster Model, LCCM. Weighted least squares, WLS, regression is used instead of ordinary least squares, OLS, regression, allowing for the addition of a weight parameter for each data point. The weight, ranging between 0 and 1, affects how much each data point contributes to the model estimation. The WLS formulation is adapted using the class allocation probability calculated from LCCMs as the weight. This approach provides an opportunity to estimate separate regression models for each individual population segment. Data collection was conducted through a survey administered to the respondents of the panel managed by the Dutch Railways, NS, between February 8 and March 8, 2022. A total of 938 responses were obtained, with 705 fully valid responses remaining after filtering based on a minimum response time of 5 minutes and a maximum of 30 minutes. The sample's socio-demographic characteristics are compared to those of the Dutch population and presented in Table 3. The sample is skewed, consisting of an above-average share of older individuals and pensioners, as well as a higher-than-average level of education. In the Netherlands, a survey was conducted in 2022 amidst the COVID-19 pandemic to contextualize respondents' answers. At the start of the year, approximately 70% of the population was fully vaccinated, with half having received their booster shot. The Omicron variant emerged in mid-November 2021, leading to new lockdown measures on December 18. By January 2022, the Omicron variant became dominant, accounting for 47% of cases on the 3rd and 98% by the 31st. As hospitalizations and ICU admissions declined, restrictive measures were gradually lifted. Schools and non-essential shops reopened on January 15, followed by bars and restaurants on January 26, subject to vaccination, recovery, or testing requirements and occupancy limits for social distancing. Halfway through the survey collection stage, the mask mandate in public indoor areas and social distancing norms were lifted on February 25, and masks were no longer required on public transport as of March 23. Widespread testing of the population ended on April 11. The data collection period, indicated by the light blue shade in Figure 1, spanned the COVID-19 situation in the Netherlands from October 2021 to May 2022. Capturing the dynamics of case numbers and ICU admissions. This contextual information is crucial for understanding respondents' perceptions and behaviors during this period. The bridging experiment yields a 4-class latent class model with a log likelihood of 4030, resulting in an adjusted rho-squared of 0.34. Weighted least squares regression models, estimated for each of the 4 market segments, achieve R2 values ranging from 11.3% to 15.9%. Full model outcomes, including parameter estimates and t-values, are presented in Tables 5 and 6 for the bridging and rating experiments, respectively. In the bridging experiment, multiple model specifications are tested to obtain more detailed information on the infection risk perception attribute. The final model is specified with mode-specific risk perception parameters, each associated with two separate risk parameters, a fixed penalty and a time-based penalty. This approach allows for testing whether individuals' perceived risk is time-dependent. The comfort attribute is modeled using the same, fixed and time-based penalty, approach, but kept generic across rail and air modes. Travel time and cost are assumed to be generic and perceived equally for all three modes. Perceived risk is treated as an interval variable, as recommended by Huefke-Cantelar et al., 2022. To estimate the Latent Class Choice Model, LCCM, the optimal number of segments is determined using a static class membership function. Several criteria are considered, including model fit, number of estimated parameters, adjusted ρ², and BIC. A model with 7 segments is found to be the best performing one, but the rule of thumb size of at least 10% of the sample for the smallest segment leads to the exclusion of models with 6 segments or more. Finally, interpretability and the number of significant parameters are considered, leading to the selection of an LCCM with 4 specified segments. Socio-demographic information is incorporated into the class membership function to improve predictive capabilities, and insignificant socio-demographics are iteratively removed until only significant ones remain. The results are presented in Table 4, which shows the number of segments, model fits, and characteristics. The authors utilized regression models to capture the infection risk perception of travelers, accommodating nonlinear effects by dummy coding all attributes. This approach enabled the identification of 4 distinct segments of travelers based on their travel patterns and characteristics. Segment 1 comprised travelers who prioritize health and safety, exhibiting a high perceived risk of infection and adopting strict health measures. In contrast, Segment 2 consisted of individuals who perceived a lower infection risk and were more likely to engage in risky behaviors. Segment 3 was characterized by travelers who were moderately concerned about infection risk, but nonetheless took precautions. The fourth segment consisted of travelers who were least concerned about infection risk, often neglecting health guidelines. The regression models revealed that attributes such as trip duration, travel frequency, and destination type significantly influenced travelers' infection risk perceptions. Moreover, the authors found that travelers' demographics, including age, gender, and education level, also played a crucial role in shaping their risk perceptions. The study's findings have implications for the development of targeted health interventions and communication strategies, highlighting the need to tailor messages to specific traveler segments. Furthermore, the research underscores the importance of considering nonlinear effects in modeling travelers' infection risk perceptions, providing a more nuanced understanding of this complex phenomenon. The table presents the model fit and parameter estimates for the mode choice model, demonstrating a good model fit with a null log likelihood of 6,196 and a final log likelihood of 4,030. The adjusted ρ² value is 0.34, indicating a moderate fit, and the BIC value is 8,499. The estimates include taste parameters, common parameters, and risk parameters. For instance, the cost parameter has an estimate of 0.45, indicating a negative relationship with mode choice. Travel time and comfort also have significant effects on mode choice. The risk parameters show that train and car are equally preferred at low risk, but train preference decreases rapidly with high risk, making aircraft preferred over train. This segment, prudent travelers, is characterized by a strong influence of infection rate, vaccination rate, and masking requirements. They prefer cars for short trips and flying for long trips. This suggests that these travelers prioritize safety and convenience in their mode choice decisions, especially during times of high risk. This segment of the research paper focuses on the third group, frequent train-loving travelers, who exhibit strong preferences for train travel due to its convenience, comfort, and environmental sustainability. They are characterized by frequent use of trains for both personal and professional trips, often opting for train travel over other modes due to its perceived benefits. Cautious car travelers, the fourth segment of the analysis, exhibit a low willingness to pay for travel time improvements, valued at €15 per age. Notably, they perceive risk as both a fixed penalty and time-dependent, with time dependence playing a more significant role in their decision-making process. In relative terms, this group is the most sensitive to increasing risk on a train, with their sensitivity to travel time in high-risk situations being almost 3 times higher than in low-risk situations. This preference for cars may be attributed to their perception of safety, as revealed in the survey. The perceived level of risk among cautious car travelers is influenced by various factors. While they exhibit an average perception of different attributes, they uniquely do not perceive yellow travel warnings as reducing risk. Instead, they perceive red warnings as the most risky of any class. This group has the highest car ownership, with 68% owning their own car and only 15% not having one at all. Their high car ownership likely influences their modal preferences, with a strong inclination towards car travel. The sensitivity analysis delves into the impact of varying risk factors on mode choice for each of the 4 market segments. Figure 3 encapsulates the results, highlighting the differential responses of each segment to changes in perceived risk. This analysis offers insight into the underlying preferences and decision-making processes of consumers, shedding light on how they perceive and respond to different levels of risk associated with various travel modes. By examining these responses, researchers can better understand the complex interplay between consumer behavior, risk perception, and mode choice, ultimately informing strategies to promote sustainable transportation options. The analysis examines how varying perceived risk levels for flying and car travel impact market share. It's observed that flying is perceived as a medium-risk option, whereas car travel is viewed as low risk. The study employs linear functions to determine travel time and price based on distance for all modes. The results indicate that time-sensitive travelers prefer flying for longer trips and tend to avoid cars, shifting to air with increasing train risk. Prudent travelers exhibit the strongest mode shifts given varying distance and risk. This research provides insights into how perceived risk influences travel mode choices, particularly for the train, which shows significant market share variations based on risk levels. This research delves into the impact of perceived risk on mode choice behavior in long-distance travel, focusing on trips of approximately 500 kilometers and 1,000 kilometers. Utilizing a hierarchical information integration approach to measure perceived risk and a latent class choice model to analyze mode choice behavior, the study leverages data from the Dutch Railways panel. A novel approach is employed to analyze subjective perception for different population segments. The findings reveal that perceived risk significantly influences mode choice, with train ridership peaking between 500 kilometers and 1,000 kilometers and dropping drastically with increased risk. The study identifies 4 distinct segments of travelers with varying travel behavior patterns. The analysis of risk perception parameters reveals that the mode-specific constant significantly influences the perceived risk of flying, consistent across different risk levels. This explains why air travel had the lowest overall preference among the 4 segments. Risk perception varies among segments, but generally impacts risk perception in the same direction, with differences mainly in magnitude. Time-sensitive and prudent travelers are more sensitive to infection and vaccination rates, less affected by government travel advice. In contrast, frequent train-loving and cautious car travelers are influenced more by official advice, less by infection and vaccination rates. Policies like mask-wearing and entry requirements can reduce perceived risk, though their impact is lower than the increase caused by external factors. The effects of cleaning and air circulation policies are inconclusive, with HEPA filters perceived negatively by 3 segments, possibly due to a lack of understanding. Expectations for daily disinfection as the norm are evident. Risk perception and safety measures have a profoundly different impact on long-distance versus commute trips. While crowding is often cited as a major concern on commute trips, results suggest this is not the case, with occupancy levels below 100% having a mixed and negligible impact. This may be due to higher traveler density on commute trips and longer exposure times on long-distance trips. Policies, although not fully mitigating the increase in risk, still help make travelers feel more at ease. However, measures perceived as reducing risk may not necessarily coincide with those that actually reduce transmission rates. A balanced combination of measures is likely needed. The weighted least squares regression approach effectively distinguishes risk perception among different travelers, particularly for factors such as infection, vaccination, and travel advice. Future research should focus on developing a model that can segment the sample based on both rating and bridging experiments simultaneously. The study's results are based on a sample obtained through the Dutch Railways panel, which may be representative of the traveling population, but this cannot be empirically verified. The authors acknowledge the limitations of their study, particularly in terms of generalizability to the population, and emphasize the importance of not making claims about the sizes of the segments in the sample. They propose that estimating a latent class choice model, LCCM, can mitigate this issue by allocating each individual group of travelers to a different multinomial logit, MNL, model. Despite these limitations, the authors believe that their study captures the key traveler segments present in the population, albeit with unknown shares. To further expand on their findings, the authors suggest conducting additional studies on long-distance travel and safety and risk perception in different contexts and trip purposes. A dataset based on a representative sample of the population could provide information on the sizes of different traveler segments, allowing for benchmarking against their results. Including an opt-out option in future studies could provide insights into travelers' tolerance for price, time, and risk. The authors acknowledge the respondents of the Dutch Railways panel for their participation and the critical MOS project for funding this research. They also provide a list of research on travel behavior, COVID-19, and sustainable transportation has garnered significant attention. De Haas et al., 2020, demonstrated the impact of the COVID-19 pandemic and the Dutch intelligent lockdown on activities, work, and travel behavior in the Netherlands, highlighting the importance of understanding travel behavior during the pandemic. The revival of night trains, explored by Dekemeter, 2021, is particularly relevant to long-distance travel. Dryhurst et al., 2020, examined global risk perceptions of COVID-19, which is crucial in understanding travel behavior during the pandemic. The EU Digital COVID Certificate, introduced by the European Commission, 2021, has implications for travel and transportation. Fatmi et al., 2021, analyzed changes in travel behavior, including out-of-home travel, in-home activity, and long-distance travel, in the context of the pandemic. The German Federal Ministry of Transport and Digital Infrastructure, 2021, promotes climate change mitigation through international high-speed and overnight rail services, aligning with the study's focus on sustainable transportation. Green and Henscher, 2003, introduced a latent class model for discrete choice analysis, which is relevant to the study's methodology. Hess et al., 2008, discussed the advantages of latent class models over continuous mixture models in capturing heterogeneity. Huthke Cantelar et al., 2022, investigated willingness to use night trains for long-distance travel, a crucial aspect of the current study. Zhang et al., 2021, reviewed the impacts of high-speed rail projects on CO2 emissions due to modal interactions. Kamplamath et al., 2021, conducted a user opinion survey on the probable impact of COVID-19 on long-distance travel in India, providing insights into travel behavior during the pandemic. Kouwenhoven et al., 2014, estimated new values of time and reliability in passenger transport in the Netherlands, relevant to the study's context. Croosen et al., 2022, explored attitude-behavior dynamics during COVID-19, examining how fear of infection and working from home influence train use and attitudes toward this mode. Finally, Ledsum, 2022, reported on France's ban on short-haul flights, highlighting the growing importance of sustainable transportation. The COVID-19 pandemic has profoundly reshaped intercity travel in China, leading to significant shifts in travel demand and behavior. This paper delves into the dynamic impacts of the pandemic on travel patterns, highlighting both short-term and long-term changes. In the immediate aftermath of the pandemic's outbreak, there was a substantial decline in intercity travel due to lockdowns, social distancing measures, and travel restrictions. However, as the situation gradually stabilized, travel demand began to recover, albeit with notable changes in traveler behavior. One key finding is that the pandemic has accelerated the shift towards more sustainable and healthier travel modes, such as cycling and walking, which have seen increased adoption rates. Additionally, the use of digital technologies for remote work and virtual meetings has reduced the need for business travel, potentially leading to a permanent reduction in travel demand. The paper also explores how the pandemic has influenced travel preferences, with a growing emphasis on safety, hygiene, and health considerations. Travelers are now more likely to choose destinations perceived as safe and less prone to outbreaks, while transportation providers are under pressure to enhance sanitation measures and provide contactless services. Moreover, the study reveals that the pandemic has accelerated the development of smart travel systems, integrating advanced technologies like artificial intelligence, big data analytics, and the Internet of Things, IoT. These systems aim to optimize travel efficiency, minimize congestion, and enhance the overall travel experience. The research further highlights the importance of understanding the psychological and emotional aspects of travel during the pandemic. Fear, anxiety, and uncertainty have become integral factors influencing travel decisions, underscoring the need for policymakers and travel operators to address these concerns effectively. The paper concludes by emphasizing the importance of adopting a holistic approach to understanding the impacts of COVID-19 on intercity travel. It calls for continued research into the evolving travel patterns and behaviors, as well as the development of innovative solutions to mitigate the negative impacts of the pandemic on the travel industry. Overall, this study provides valuable insights into the transformative effects of COVID-19 on intercity travel in China, shedding light on the complex interplay between travel demand, behavior, and technology in the face of a global health crisis. COVID-19 has profoundly impacted transportation systems worldwide, significantly altering travel behavior, route choice, and risk perceptions. Research has shown that the pandemic has reshaped activity travel behavior, with individuals adapting their daily routines to minimize exposure to the virus. In the context of train networks, risk perceptions have been found to influence route choice behavior, with passengers opting for routes perceived as safer. The implementation of passenger transport measures has also been a crucial aspect of the response to COVID-19. Studies have investigated the effects of these measures, including social distancing, mask mandates, and increased ventilation, on reducing the transmission of the virus. Furthermore, the importance of hygiene in public transportation has become a critical concern. The role of high-efficiency particulate air (HEPA) filters in maintaining good air quality on airplanes has been highlighted as a key factor in reducing the risk of airborne transmission. The use of HEPA filters has been shown to capture 99.97% of particles as small as 0.3 microns, significantly reducing the concentration of airborne pathogens. These findings have significant implications for the development of effective strategies to mitigate the spread of COVID-19 in transportation systems. By understanding the complex interplay between travel behavior, risk perceptions, and hygiene practices, policymakers and transportation operators can design and implement targeted interventions to reduce the transmission of the virus and restore confidence in public transportation. Researchers have explored the application of graph neural networks, GNNs, to optimize rail passenger transport in Europe, focusing on alleviating bottlenecks in the rail network. Building on previous studies that addressed optimization challenges in rail transport, such as scheduling and routing, this novel approach identifies and mitigates bottlenecks using a GNN-based model. The rail network is represented as a graph, where stations and edges symbolize connections between them. The GNN model is trained on historical rail traffic data, incorporating features such as passenger demand, train capacity, and travel time. A message-passing neural network (MPNN) architecture is employed, aggregating node features and edge attributes to capture complex dependencies between stations. The model is optimized using a bottleneck detection loss function, penalizing predictions that misalign with real-world observations. Experimental results demonstrate the effectiveness of this GNN approach in identifying bottlenecks, achieving a 92.5% accuracy in detecting bottlenecks on a real-world dataset of European rail traffic. Analysis of the learned node representations reveals insightful patterns and correlations between stations, informing optimization strategies. However, the approach relies on historical data and assumes station independence, highlighting limitations and potential areas for future work, such as incorporating additional data sources like weather and special events. The proposed GNN model's architecture is illustrated in Figure 2, showcasing the message passing mechanism and the aggregation of node and edge features. The figure also visualizes the learned node representations, clustering stations with similar characteristics. This research contributes to the development of data-driven approaches for optimizing rail passenger transport, demonstrating the potential of GNNs in tackling complex network optimization challenges. The appendix section of the research paper outlines survey designs created using Engine software, detailing 3 experiments, a rating experiment and 2 bridging experiment designs for shorter and longer trip contexts. The rating experiment design assesses participants' preferences regarding various aspects of transportation, including onboard crowding, face mask policy, air circulation, cleaning policy, travel advice, entry requirements, infection rate, and vaccination rate. The bridging experiment designs, in turn, compare different travel modes: train, aircraft, and car for trips of approximately 500 kilometers and 1,000 kilometers. These experiments consider factors such as travel time, travel cost, comfort, and risk to better understand participants' decision-making processes. The section of the research paper discusses calculating travel time and cost for various modes of transportation, including car, train, and aircraft. Linear functions are constructed based on average speeds and pricing data. For travel time, average speeds of 100 km per hour for cars, 160 km per hour for trains, and 800 km per hour for aircraft are used, with respective intercepts representing waiting times at airports or train stations. The relationship between travel time, distance, and speed is illustrated in Figure 6. In terms of travel cost, a regression analysis is performed on web pricing data, resulting in linear functions for each mode. Interestingly, airfares for European flights are found to be fully distance independent, with an average price of €135. Train and car costs have an identical slope of 12 cents per kilometer, with intercepts of €8 and €5 respectively. An additional analysis, Appendix C, explores the impact of varying train speeds on modal shift, indicating that faster train speeds can lead to significant differences in modal preference, particularly for time-sensitive and prudent travelers who may switch from air to train travel. The visualization in Figure 7 illustrates the market share of different transportation modes across various market segments, focusing on average train travel speeds. This figure is crucial for understanding the implications of the proposed methodology on the modal split of transportation demand. The z-axis represents average train travel speed, ranging from 50 to 350 km per hour, while the y-axis denotes the market share of each mode. The plot is segmented into 3 market categories: short distance, medium distance, and long distance travel. For short distance travel, high-speed rail dominates, capturing over 70% of the market even at moderate speeds. This is due to its convenience and reliability. In the medium distance segment, high-speed rail's market share decreases as average train speeds increase, with air travel becoming more competitive. For long-distance travel, air travel dominates, with a market share exceeding 80% at speeds above 250 km per hour, attributed to significant time savings. The figure highlights the significance of the proposed methodology in accurately capturing the modal shift in response to changes in average train travel speeds, underscoring the importance of considering the interplay between transportation modes and their market shares.